Medial collateral ligament sprains are one of the most common knee ligament injuries you will see. The mechanism of injury can be closed or open kinetic chain, but it will usually consist of a valgus stress being placed on the knee with or without tibial external rotation on the femur. Signs and symptoms of this type of sprain will include localized extracapsular swelling. There will probably be minimal joint effusion, although looking at it, it will appear enlarged, red, and puffy. There will be localized pain the length of the MCL. It may be point tender at the femoral attachment, along the body of the MCL, or at the tibial attachment. The position of comfort is approximately 30 degrees of knee flexion, and the individual will show dysfunction with lateral cutting and knee external rotation. Performing a gross screen for range of motion is usually done supine, with simply flexing the knee to the chest and then extending the knees as well. You'll find that the person has decreased range of motion, particularly at flexion. Special test that will be performed is a valgus stress test. This will be done at 5 degrees and 25 degrees of knee flexion. At 5 degrees, you're testing the MCL and the joint capsule, whereas at 25 degrees of knee flexion, it's just the MCL. When these ligaments are being tested, you want to assess the quality of the end feel, the amount of movement, and do a bilateral comparison. Diagnosis is going to be with an MRI. However, there may be an X-ray performed to rule out any type of fracture if it is suspected. Historically, MCLs would have received a surgical repair. Currently, the treatment is usually conservative with bracing and rehabilitation.